from the American Academy of Pediatrics.
The 2024 National Conference and Exhibition ended on October 1st, and it was an eventful one for Joanna and me. It was my 12th anniversary with Christy, a break from local politics in North Carolina. And Joanna, was this baby Zelda's first medical conference?
Well, to start, happy anniversary again, David.
Oh, thank you.
Yeah, it was Zelda's first experience with professional networking, and she has incredible headshots from the Council on Communication and Media's Mixer. So I think she might be a pediatrician one day.
Well, at just 9 months old, she still has some time to decide, but I saw the photos and I'd totally hire her. And our listeners still have a lot of time to learn from the conference and listen to virtual sessions, including getting in some pearls from the conference now as we review our favorite sessions. In this special episode of Pediatrics on Call, the podcast on children's health from the AAP, I'm Dr. David Hill.
And I'm Dr. Joanna Parga-Belinkie. This podcast is for everyone in the medical community, keeping our children healthy and safe.
It's a show by pediatricians for pediatricians.
But anyone who cares about kids will get a lot out of it as well.
Let's get right to our discussion about our best of from the 2024 National Conference and Exhibition.
And listen, this conference was in Florida where practicing pediatricians thanked attendees for coming and the Academy for being there for them, because giving care to kids in this state has become more complicated. And the show of support for the caregivers there was very needed. There were over 13,000 participants, including pediatricians, nurse practitioners, physician assistants, and other advocates.
And for everyone who is able to come in a state where they might have worried about their own safety with a hurricane and with state laws that can be unkind, thank you for your bravery and for your commitment to the care of children. You are incredible, and you have a voice this fall to vote, and hopefully the conference inspired you to do so.
So, David, let's start where we always do, with the plenary sessions. We were able to host half of them, and we welcomed other hosts to the stage, Dr. Elizabeth Murray and Dr. Khadija Tribier-Reed. The stage set represented a pediatric community, and we got to embrace ours. So what sessions stood out to you?
Okay, I'm going to start with Dr. Seema Yasmin, a public health specialist with the CDC, author, and comedian. As an author, she began with talking about some banned books, specifically a children's book, The ABCs of Queer History, and a book that she wrote called Unbecoming, which was about a futuristic world where abortions were banned and women's reproductive systems were tracked to keep them from having abortions.
Well, that doesn't sound so futuristic now, David, does it?
Yeah, she wrote it, I think she said in 2019, and now it may be just a little bit more realistic than a lot of people would like. Then she pivoted to her work in public health. So she went to Kazakhstan to deal with a measles and whooping cough outbreak that was due to misinformation and disinformation. And here's the tragic thing. We see these disinformation and misinformation campaigns coming from Russia, coming from China. We're dealing with them right here where I live and where you live. But this campaign was actually designed by U.S. intelligence services, originally to target China. But, of course, you can't keep it in one place. Then she talked about something that connects for me, which is her work as a comedian. And as you know, I've done teeny bit of stand-up comedy, but she has gone hardcore, performing in L.A., which is sort of a dream for a lot of people on the stand-up circuit. And then the fact that she went into comedy because medicine seemed to punish her for trying to take care of too many of her patients' needs, which is, I think, a thing that a lot of pediatricians can relate to. So I just found this to be wide-ranging and relatable. I will end with her book, What the Fact, on how to debunk lies, because that is a skill set that I'm afraid we're all needing to master.
And did you have one more plenary that stood out to you, David? I think we're trying to keep it to two.
Yeah, I did. So I was also so impressed to hear Admiral Rachel Levine, the 17th Assistant Secretary of Health for the Department of Health and Human Services. She is an admiral and head of the U.S. Public Health Service Commissioned Corps and a pediatrician with all sorts of medals and stuff on her uniform. It's really quite impressive. She talked about her focus on health equity, the idea that unless everybody makes progress, we haven't really made true progress. And she focused on a few issues specifically: adolescent medicine, adapting to climate change, and then the Food is Medicine initiative, which they actually launched the very next day. So she talked about how legal and political structures in states are able to support or not social determinants of health, especially when it comes to adolescent patients, and talked about adolescents who are actually moving. She called them medical refugees because they can't get the care that they need in the state where they currently live. They're releasing a Take Action for Adolescents toolkit, which is a national call to prioritize adolescent health and some tools that we as pediatricians can access to help with that. She emphasized with timing that was rather impeccable in the Trail of Helene that climate change is currently a threat, not a future threat, and that we need to adapt right now to some of the harms that we're seeing, certainly in my state, in Florida, where this conference was, and elsewhere, and to ensure that those communities that are at the highest risk of harm have the supports they need to withstand it. She really emphasized something that appeals to me. We don't have to wait for the payoff of climate solutions. No matter how you feel about climate change, the payoff of these resilience solutions comes immediately. And last, she talked about food deserts, places like East St. Louis, where there are no grocery stores for miles. And here's the thing, the soil is so polluted you can't even grow your own food. I mean, that blows me away as an avid gardener. So she talked about making sure with this Food is Medicine initiative that everybody can get the healthy food their children need.
She is so impactful, and she started in Pennsylvania, so I have a real soft spot for her and all her work. And, I think I could think of two sessions right away, too, that I really enjoyed. The first was the Reach Out and Read session with Dr. Perry Klass and Claudia Aristi. And this duo got together in New York City, worked at Bellevue Hospital. And Claudia offered this really lived experience with Reach Out and Read and how it affected her family, her own children, how it made her a real advocate for reading, and how she's become a director in the program. And so it was an incredible and impactful story. And Dr. Klass, who we've had on the podcast before. So we've done her pathways. We know a lot about her. She kind of colored in the history of Reach Out and Read and her involvement in it from really the very beginning. And it was just so powerful, and it was so positive to have something we could talk about that we can all agree on, that reading is so beneficial to children, and that if we can start early and we can influence their literacy and we can instill a love of books, that it has real health benefits. And it was also on the heels of a new policy statement coming out from the AAP. That was released on the same day. So that was just a really wonderful and lovely thing to go through. And talking about books, I think, lends itself to talking about media a little bit, right, David? I don't know. If you listen to books, I guess. My husband and I always debate if listening to books is actually reading them. But that leads to kind of my next set of plenary speakers, which were Dr. Jenny Rudetsky and Dr. Megan Moreno, and they are the heads of the Center for Excellence in Social Media and Youth Mental Health that the AAP runs. And this was like really their platform to talk about the 5 C's. And David, we kind of knew about that because we also had Drs. Rudetsky and Moreno on the podcast talking about the 5 C's and talking about how we can use them sort of as a way to talk about media. And those 5 C's are the child, like looking at the child as an individual, the content of the media that you're consuming, if you're using it to calm, right? So if it's being used as a way to regulate, crowding out. So is it crowding out other things in your life? And communication. And I think the big take home there was we know media, and when used in excess or when not maybe controlled for children, because we know a lot of the media engines don't think about children in the development of apps or websites and other things, can maybe be detrimental to kids. We don't know to what extent. There's a lot of research that needs to be done. But I think what was really interesting that Dr. Moreno and Radesky did is they really tried to frame it in the positive, right? Like, what can we do to be empowered in our use in media? Knowing that it might not be beneficial for us, what can we do to talk about it? What can we do to start understanding it more? And what can we do to help regulate our usage and try to make it as beneficial as possible? And I think the takeaway there was you don't have to sit and do the 5 C's in every single clinic visit. In fact, you can maybe even pick a few to focus on with a family. But what we need to do is start collecting more data on this. But we also need to be able to talk to families about it. And we don't want to be fear-based when we talk about it. We want to be empowering, you know?
Well, I absolutely love that, this idea of empowerment as opposed to fear. And of course, Doctors Radesky and Moreno are two of our favorite guests, and we've both worked pretty closely with them now. So I was so impressed that we had a chance to share their wisdom with everybody there.
And there's such a wonderful, I highlighted a lot of duos on stage, kind of like you and I, David.
Yes.
But, such a powerful talk.
Yeah. It's a little easier to talk about the plenaries because there's a set number of sessions. But when you've walked your 10,000 or more steps through the convention center, you can get overwhelmed by the number of educational sessions. It's always a challenge for the two of us to pick just 5 each and give you a sort of top 10 from our experiences. But let's try.
I know, it's so hard, David, and I'm going to be watching sessions online all the way until January 31st, 2025, because there's so much to learn. But for today's episode, we had to make these tough choices. Are you ready to share them, David?
By all means, let's go.
So I'll start with one by Dr. Michelle Terry from Seattle Children's, and it was entitled, "I Was on the Internet and When Patients Seek Out Unproven Medical Therapies in Pediatric Medical Care." And it goes over what unproven means and sort of laws and regulations about the care we provide, along with case examples. But what I thought was most interesting, like a little pearl that I want to throw our listeners, is red flags and communication. So things you can look for when your patients are talking about these things that they've seen online. So some red flags that Dr. Terry mentioned were a lack of evidence. So this product relies on a lot of testimonials instead of professional endorsements, and a lack of regulation as well. I thought that was interesting. And when there's a lot of complicated use of language, so it sounds medical, but it's really just meant to confuse you. And we as pediatricians really have a mission to help parents sort that out. And also there was a red flag for like secret ingredients, which might be good for like if your aunt is making meatloaf, but are probably not good for medical treatments or therapies. And then emphasizing communication, how important it is, how we really have to be active listeners and be empathetic. And it can be really hard to be when these unproven treatments or therapies are getting thrown at us. And trying to give good evidence and explain risk in a way that's non-judgmental. And again, actively listening and following up with families.
Well, I try to spend a lot of my learning time on issues that are really germane, especially to the newborn nursery, which is now where I spend the primary portion of my clinical time. So when Dr. Karen Popolo, a true trailblazer in neonatology, stands up to speak, I am always ready to listen. And she spoke on an issue that we've been struggling with at both the hospitals where I attend, neonatal CMV testing. Should it be universal? Should it be targeted? Should it be some combination? And I was delighted to hear this. So first thing, urine is the gold standard for CMV testing, but saliva is almost as good. And we're actually using saliva in one of my institutions and I think urine in the other. North Carolina is among the states that have high levels of CMV infection. And those are really associated with social determinants of health. So in communities that are struggling more with poverty, with any of these issues, we also see more of that CMV. I also got a good understanding of the range of congenital CMV. There's all this subclinical, doesn't really matter CMV, so you can detect it, but baby looks good, why do you care? And then you've got hearing loss, and then you've got small for gestational age, microcephaly, neurologic problems in more severe cases. And part of the challenge here is detecting the cases that are worth treating and not worrying so much about the cases where you never would have known they had it. So she talked about different screening protocols. Should it be clinical based on symptoms? Should it be targeted based on hearing screens? Should it just be for all babies? And when you're looking at a disease that affects 1 in 250 newborns overall, you want to find it if you need to, but only moderate to severe disease really counts. So what I got from it was that the targeted screening that we're doing at both my hospitals, which is any failed hearing screen, microcephaly pretty much, plus or minus small for gestational age, probably is catching most of what we need to catch. But there's a lot of research left to be done in the best possible screening pathway. So I'm going to be coming back next year to hear what we've learned in the meantime.
And we're doing very similar screening in Pennsylvania, so it's always good to listen to Dr. Popolo. I went to a session that I want to say is in honor of a pediatrician, Dr. Florencia Segura, whose daughter Rosie I actually met at the conference last year in D.C., and she died of sudden unexplained death in childhood. And so it felt really important to go to that session.
Yeah.
It felt really important to go and understand more about the condition for Rosie and for other children like her. And it was led by Dr. Erin Bowen, who practices in Connecticut and unfortunately had a similar loss of her son. So it was really a very emotional presentation. And I think most people know about SIDS and SUID as well, but for children over a year of age, this kind of unexplained death is really less well known, but it accounts for around 500 child deaths a year. And it really wasn't even described until 2005. And the lecture is recorded, so I really want everyone to watch it. It talks about ongoing research. It talks about similarities in cases. And I don't want to list them here because we don't know what causes these cases, so it was just pointing to things that you might look for, but it's still a very rare occurrence, and there's so much research that needs to be done. And what I thought was also really powerful is you had Dr. Bowen talking about her own experience, but you also had tapes of families who have experienced this and just what it was like to lose a child and what you have to go through when you lose a child and discovering things they never knew about the process. So having to talk to a coroner, having to deal with an autopsy, things that actually we as pediatricians do know. And so how much you can help families through that. And so I mention it here on the podcast too, because we need more awareness about this and we need more research. So I beg everyone to watch it and in honor of these children who've lost their lives.
Wow. That is profound, and it is now the first thing that I will watch when I resume catching up with these sessions. I'm going to pivot to something that is one of my number one admissions when I'm working full spectrum hospital pediatrics, and that's pediatric appendicitis. And just when I think I know what we're doing, it changes. And so I was very happy to hear from Dr. Raquel Gonzalez about what is happening right now. Specifically, the focus was on when we might perhaps use non-operative management, which, back when I was training, that was not a thing. If there was an appendicitis, it had to go, right? You're just going to open it up and take it out. But there actually is increasing acceptance of non-operative management, but with some real caveats. So Dr. Gonzalez did a deep dive into the literature, and I will not do it justice, but the top points for me were that laparoscopic appendectomy remains gold standard treatment. Non-operative management can be acceptable, especially in uncomplicated acute appendicitis, with the parents understanding that a fair number of these children may get recurrent disease and go on to needing surgery. Now, what surprised me a little bit is that you can use non-operative management in some complicated appendicitis. You want to really think about it hard before you go that way with an appendicolith, because there is a higher risk of surgery and failure in the future. The thought is, if it's complicated and you've got a good laparoscopic surgeon where you work, you probably ought to go ahead and let them do their thing. But if they get better non-operatively and they're fine to go home without that surgery, you might not need to bring them back for a scheduled interval appendectomy if you have shared decision making. There's more here, and I would encourage people who encounter appendicitis, especially my colleagues in hospital pediatrics, to watch the whole thing. But I think it still comes up ultimately with shared decision making. We have to talk to parents about risks and benefits in an evidence-based way and get a sense of what they feel most comfortable with. She did have a tip that there is an American Pediatric Surgical Association toolkit for potential quality improvement initiatives. So if you think this is your next project at your institution, you can see what other people have done, what problems they had doing them, and maybe you can do even better where you are.
Such a worthy QI initiative, right? Because this is just such a common thing. And I'm going to change gears because there's really just like such a depth and breadth of topics here. But the next one that I wanted to highlight was preschool predicaments, increasing awareness to early intervention services. It was by Dr. Tony Whitaker from Memphis, Tennessee, and Dr. Jennifer Poon, who's in Georgia. And it was about early intervention services, which I refer a lot of my NICU babies to. And I always worry about access to those services. And now I have kids that are young and early on in their education. And it's just amazing to think of how fast young brains are growing and developing and how much interaction from their peers matters and how much services can really matter in that development. And so the talk really empowered pediatricians to do developmental screening and know their local resources along with laws covering for extra resources for kids. So I always think of early intervention as in those first 36 months, identifying kids who have a delay or a diagnosis that could cause a delay and making sure they have extra services. But I didn't know that in some states, 7 in the country to be exact, you can extend that coverage for some kids. So you should know if you're in one of those states. And it goes on to preschool and into the school years, and they have other services there and if you go look at the slides, there are amazing links to free resources throughout the country when you're doing these developmental screens for your kids. And it really was just a highlight about how much pediatricians can influence early child learning.
I love that. That's such a big part of what we do. I went back to the newborn nursery again to get a sense of what is trending in the newborn nursery, specifically Controversies in Evidence, which was co-hosted by Dr. Alison Markowski and Dr. Arun Gupta. And their first issue was one that we are very familiar with from talking to our friend Dr. Alex Kemper. What happened when we instituted the 2022 Bilirubin Guidelines? Did we miss any serious cases of jaundice because they were less strict than the older guidelines? And the answer is the overwhelming burden of literature says, no, we did not miss any serious jaundice when we made that switch, but we did reduce the number of bilirubin lab draws that we do and our use of phototherapy. So that's exciting to me because we worked really hard to put those guidelines into place at both of my institutions, and I'm really happy to know that we didn't pay any price of decreased sensitivity with those. Similarly, they evaluated the outcomes of the early onset sepsis calculator compared to the old sort of CDC 2010 sepsis guidelines. And I am a huge fan of the sepsis calculator because, of course, it has dramatically decreased the amount of excess treatment and overdiagnosis that we're doing. And I was really excited to see the calculator vindicated over everything else. But they surprised me a little bit because when the AAP came out with its clinical practice guideline on early onset sepsis, they actually said you could go with kind of the old guidelines-ish, you could go with the sepsis calculator, or you could just do enhanced observation, which is essentially watch every baby for like 36 to 48 hours, and if they get sick, do something. It's a little more complicated than that, but not much more complicated than that. Not like the sepsis calculator, which gives you this beautiful number, and they went deep into the numbers, which I really enjoyed. And I was like, they pointed out that really enhanced observation is about as good because the clinical appearance of the baby has such a profound impact on the outcome of the sepsis calculator. You could just go with that. So I don't know that I'm ready to leave behind my beautiful little algorithm and all the cool numbers it produces, but there is an argument to be made for look at the baby, right? We talked about RSV, and just last week I started administering nirsevimab at our hospital. But of course, if mom can get the RSV vaccine, which they're not yet in Goldsboro, that's fantastic. But the takeaway on this is to remind parents that RSV is a really severe disease. And when they know that, both the nirsevimab uptake and the RSV vaccine uptake goes up. They talked about neonatal opioid withdrawal syndrome. We've talked before about how much we love the Eat, Sleep, Console protocol, but they did mention that it could use more study. So that was, I'm all in on Eat, Sleep, Console, but I have to recognize that we don't know yet exactly what the long-term implications are of using it. So that was humbling. And finally, we've talked about this before as well, ankylosing. They stressed that frenotomy is a reasonable intervention, but stressed again, as we have before, that really you'd like to do a thorough differential diagnosis, evaluation, and get really good lactation support. They also reiterated that lip ties are clinically almost certainly meaningless. Last, car seat tolerance screens. We have addressed this at our newborn nursery just this last month. Still recommended for late preterm infants, but the data continue not really to show any significant benefits. So it's one of those things people are still doing, but it's not clear that we really need to be.
I love talking about babies. And also breastfeeding. You mentioned ankylosing. I've shared my personal experiences with that and trying to breastfeed a baby. So I tried to get to some sessions around breastfeeding too, and I wanted to highlight one on donor human milk. It was called Got Milk, Evidence and Best Practices for Use of Donor Human Milk. And it had presenters Dr. Rakshi Bashra and Shimona Thakrar. And it had some main points. One was that we need to use donor milk for premature infants, but anyone can access it. So there are term infants that get it too. I know in my own hospital, we give term infants donor milk as a bridge when we're waiting for maternal milk supply to come in and if they're really dedicated to breastfeeding and need supplementation. But there has to be a reason that they need to get supplemented when they're term, and we're trying to get better about documenting that at my hospital too. And a reminder, though, that formula is a great nutritional option for infants and one that they may need as well, especially if there's not good access to donor milk. And what I thought was really interesting, because I'm kind of a history buff and I love medical history, is they went over the history of banking human milk, which really dates back to the early 1900s in Europe and Vienna, and that the U.S. had their first bank in 1919, and that in the 1930s, banks started to expand, and kind of the milk banks that we know today started to form in the 1980s, and there's been evolution of milk banking since then. So that was really cool to hear that history. And then they talked about equity and access to it, which has been a challenge. And they also went over how you can donate. As a lactating individual, I wish I had more supply to donate. But anyone who's listening, there's ways that you can steer families toward that. So if you look to this lecture, they'll go over how you can access milk banks and how you can see if you have an eligible donor in your patient population or if you yourself are an eligible donor to do it. And then lastly, they talked about the Donor Milk Act and supports for donor milk through Medicaid. And it's exciting that this resource is just becoming more well-known and more well-supported when families want to donate.
I love that. We've also covered that topic recently, so I love all the reflections and refractions of the things we're thinking about. The next lecture that I was particularly interested in was especially germane in Florida, where we were meeting. This was the section on Minority Health, Equity, and Inclusion program impact of book banning on emotional development and literacy, there were three speakers, Jennifer Walton, MD, Andrew Spar, and Tamika B. Hobbs, MA, PhD. And they discussed book bans in a framework that I had not really heard about or thought about before. So Dr. Walton talked about book bans in the context of children's moral development, right? So kids are figuring out their morality, their approach to life, what's right and wrong. And by exposing children to different ideas, they can bounce off of those ideas. They can take them home and talk to their families and say, how do we feel about this? What's the right way to feel about this? And by restricting the sorts of subjects or topics that they can explore, it really restricts families and children's ability to help them build a moral framework around thinking about some very delicate and difficult topics. But thinking about delicate and difficult topics is part of how you build a moral framework as you grow. They also mentioned that in polls, despite the fact that these bans have been successful politically in some places, including where I live, voters overwhelmingly do not like them. They realize that letting some parents control what books all children can access may disadvantage their own children in unpredictable ways. They mentioned the need for historically marginalized children to be able to read about circumstances like their own, because they're building their sense of identity, their sense of belonging, their sense of history. And some of these bans are kind of willy-nilly pulling out books that help kids in underrepresented groups or marginalized groups understand what their own background was and take pride in their identity. Andrew Spar is president of the Florida Education Association, and he pointed out that limiting what kinds of books kids can read when they're age appropriate really harms everyone's education. And then Tamika Hobbs with the African American Research Library and Cultural Center in Fort Lauderdale talked about how these bans on multicultural education can really affect the mental health of children of color who need stories where they can see themselves reflected. So, as these bans continue to march across the country, as I think the upcoming election, people are going to be making some decisions based about those wherever they live, understanding the full impact of these bans on everyone, I hope is going to help people as they move forward.
I'm so glad you highlighted that session, David. It gets back to how important books are and how influential and impactful they are for our children. So that's a great one to go listen to. And my last one, can you believe it? This is number 5. I feel like I could keep talking about these sessions forever, but I had to distill it. Was Food for Thought, Practical Interventions for Picky Eaters by Dr. Praveen Godey. And this was part of the Passport to Pediatric Medical Specialties pilot program at the conference, where you could explore different subspecialties. And this was considered developmental and behavioral pediatrics, not GI, because I didn't think they had GI listed as one of the subspecialties. But anyway, you can complete a survey on your sessions and get put into a raffle to win a $100 Amazon gift card. And I'm not organized enough right now in my life to get this money, but maybe one of our listeners is. So look out for this Passport to Pediatric Medical Subspecialties pilot program. But the Food for Thought lecture was about picky eaters, defining picky eaters as low food consumption and a limited variety of what they eat, which is helpful to frame this kind of discussion. And it's more than just picky eating if it's causing a medical or nutritional dysfunction, right? Like they're having aspiration pneumonia or they're having micronutrient deficiencies or something with their feeding skills, or there's some psychosocial dysfunction that's occurring. Then it goes into the realm of a pediatric feeding disorder, and you're outside of the realm of just a picky eater. And then it went over how we as providers can make sure children become healthy eaters. So introducing solids by 6 to 9 months, trying to give a lot of variety, and having parents use praise and not rewards to help encourage eating. And so this session is just a must-watch for pediatricians to give tips to all the picky eaters out there.
Now, I have to ask, so far, have you had to deal with this in your own household yet?
Yes, David. That could be a whole podcast on the fact that my daughter Mira only eats about like 6 different types of food. So I needed this for myself as well.
Good. Good. I think most of us who are parents have had some contact with this issue. One last one for me, and this is critical for where I live because we have been one of the worst affected communities by PFAS, was Dr. Lauren Zajac unveiling the hidden threat of emerging pollutants. And she actually discussed 2 pollutant classes. One is per- and polyfluoroalkyl substances, which is the PFAS I was just talking about. The other is micro and nanoplastics. Now, the PFAS is ubiquitous, but like I said, our area of the country has been particularly severely affected. And knowing what these chemicals are, we call them forever chemicals. The half-life in humans can be from days to years. There are thousands of different ones, so it depends somewhat on the individual chemical composition. What we know from animal studies are associations with liver toxicity, immunosuppression, developmental toxicity, even fetal loss. Human epidemiology shows decreased vaccine response, shows preeclampsia and hypertension in pregnant women, lower birth weights, and even kidney and testicular cancer. And I have people in this area ask me all the time, what has the water done to my child? Or is that what made them sick? And it's very difficult to answer those questions for any specific case, even though across populations we know they're having this effect. She stressed that you can test people's blood for PFAS, but there's really no idea what to do with those test results. They're not well validated. They don't really predict a level of disease in an individual, and there's no specific treatment for these other than avoidance. The big thing is avoiding drinking water that is contaminated, and we've had both changes to our water system, but a lot of people in this area have also installed various types of filters, including reverse osmosis, to deal with this problem. They also suggest mop your floors, vary your diet, don't eat the same thing over and over again, and avoid Teflon cookware, which I have to admit I've been doing for several years now. When it comes to plastics, this was a lot of information I had not run into before other than, newspaper headlines. But plastics get into us in a couple of ways. Sometimes they're manufactured very small, like little scrubby microbeads that might be in some soaps, or they get broken down in the environment. And they may carry additives or dyes, including heavy metals. The shape of these little tiny microscopic and smaller pieces can also be an issue in themselves. They can be sharp and jagged. They can get into our bloodstreams, our lungs, our brains. That's a little bit scary, but here's the best one. We could be ingesting up to 1 credit card a week of microplastics. That one sticks with you, doesn't it? There's also...
This is like such an about face, David, from the Plastics
right?
Make It Possible commercials that used to be on when I was a kid. I don't know if you remember those, and it was like raw plastics. And
I will tell you, we just replaced all of our plastic food storage containers with glass ones as a result of this. And now, according to this talk, I'm also going to get rid of our plastic cutting boards. Wood works just fine. And finally, they talked about phthalates, bisphenol A, flame retardants, all that have well-known endocrine and neurologic effects as well.
Yeah, it's just so hard when you have kids to think of doing everything in glass. But I did glass bottles with Zelda, and it's been an adventure. I've only broken one in 9 months. But we could go on and on. That is all the sessions we have time to share. But I also wanted to take time to thank everyone who came up to me to help me with baby Zelda and who supported me in parenting while I was trying to engage and learn about my profession, for holding Zelda, for hugging me, and for just keeping me going in this first year postpartum at a professional conference where it can be just so hard to get through this year. And I got through it with so many amazing pediatricians in Orlando, and I am forever grateful.
Well, you definitely got through it with grace, and it was admirable to watch. But it does take a village, and we have one that's about 67,000 people large, so they're all ready to help. And I feel the same way as you. That support that we get at the conference is just incredible. And then when I see who comes to the live podcast recording we did, I'm always floored by how many people listen and learn and connect with us. So I just want to thank everyone who came up to me, who asked how I was doing, who listened in person, and I cannot wait to connect with you again next year.
Definitely. And if you missed the conference, it's not too late. You can access a lot of the content online now until January 31st, 2025. Just go to aapexperience.org.
The next national conference will be September 26th to September 30th in Denver, Colorado. Mountains of connection, information, and sharing to be had out there. So saddle up and ride out with us.
I'm not sure the theme is cowboy, but I do love a good visit to a ranch and horses. So I might take you up on connecting with nature on horseback, David. I'm going to bring jeans and not just my usual conference clothes.
I think I own a pair of jeans as well. We're going to find out by next year, and I can't wait. That's it for today's episode. If you like Pediatrics on Call, please subscribe on your favorite podcast app and help us spread the word. Follow us on Facebook, Instagram, and YouTube at Pediatrics on Call.
Pediatrics on Call is a production of the American Academy of Pediatrics. Our producer and editor is Ann Johnsos. Our audio engineer is Doug Nagel. Joe Puskars is our associate producer, and Susan Martin is our executive producer. Our theme music was composed by Matthew Simonson.
For more information on the National Conference and Exhibition, go to aap.org/podcast. I'm Dr. David Hill.
And I'm Dr. Joanna Parga-Balinki. Thanks for listening.